Hello, chiropractors, slayers of subluxation, unleashers of the imprisoned impulse. I'm Dr. Anthony Pellegrino from ChiroEdge, and welcome to this week's Chiropractic Research Breakdown, where each week we break down the most relevant chiropractic science and philosophy to empower you with the ammo and certainty to change your community from the inside out. We have 3 different articles for you today that we are going to be going through. The first is something I think is hugely important as we continue to discuss the impact of chiropractic care and the prevalence of whiplash and concussion injuries. Specifically, it's going to be looking at concussion and whiplash with rear end collisions as well as football injuries. So we're going to go over different things you need to know about concussion whiplash in itself, as well as this particular of that research and how it applies to you. We're also going to be going over a new case study that's published, as well as we're going to be looking at a global perspective on musculoskeletal conditions. As always, you can receive this information straight to your inbox every week in patient newsletter and social media format, branded specifically to your office, by getting a free trial at chiroedgemedia.com. So without further ado, let's jump right in. All right, I am very excited to go over this article with you. A quick thank you to my brother in research, Dr. John Chung from Florida, who is the guru, I would say, for chiropractic and whiplash and concussion injuries. Check him out at protecttheneck.com. But he brought to my attention through his email list a article from 2016 in the Journal of Orthopedic and Sports Physical Therapy called Whiplash Injury or Concussion, a possible biomechanical explanation for concussion symptoms in some individuals following a rear end collision. Now, one of the things that we talk about a lot is a lot of the times with a football type injury with a motor vehicle accident, people are always just looking at the brain, right? What is going on with the brain? But we got to remember that the neck is attached there, right? So it's very difficult to imagine a head injury without having neck injury as well. And obviously what we know in chiropractic is that not only do we look at the overall just nerve tension, nerve function, muscles, and ligaments, but also the spine is what allows the proper flow of cerebrospinal fluid, which is going to allow for proper healing and protection of the brain as well. So any subluxation coming from an injury like that, for example, will cut off the brain's ability to properly heal from a brain injury, which is the reason we always recommend people get checked following a concussion, and etc. But they're going to look at the other way as well. Is something that typically would be a whiplash injury, like a rear end collision, going to affect concussion? So what's really a couple things to note here is that they, in terms of just education and understanding concussion as a clinician, is that typically people with whiplash or concussion recover within the first 3 months. Decreased or poor functional recovery, basically people who aren't going to be as likely to fully recover within those 3 months, are people who are older, females, and people who have acute symptoms. And so obviously, if they have acute symptoms, it's going to be more difficult to recover. So the biomechanical distinction between whiplash injury and concussion is very unclear, especially in rear end collisions, because they have such a high risk of whiplash injury, and the head also impacts the rear restraint. So they put these models up of these both football injuries and rear end collisions where they're monitoring with whiplash, peak brain stress, head velocity, etc. And when you think about it, and I'm going to kind of doing a demo which you guys can't see, is if your car is struck from the back, right, what's going to be, there's basically 4 different collisions essentially that are going to happen. And those are, first, the torso is going to move backwards and hit the seat behind you. After that torso hits the seat behind you, the head is going to whip backwards, and it's going to continue to first retract and then extend until we hit the headrest behind us. After that, the torso and the head are going to whip forward, which is where that whiplash type injury comes in. And if we're not wearing a seatbelt or something like that, we can collide with the window pane or with with the steering wheel essentially in front of us. So we have these different collisions here. So obviously, the position of the headrest is really important. And that's one of the things that they're measuring in this is during a rear end collision, what is the difference in brain and brain strain, essentially, when a headrest is directly behind our head, or when it's down. And as I'm sure you guys can imagine, with a headrest down, we're going to have much more trauma to the head and neck. So that's really what they kind of conclude in this article, and we're going to take other things from it as well as we continue to dive into it. But just know that in terms of education for your practice members, for yourself, a headrest up being directly behind your head is crucially important. Now, what they found was that, obviously, they had a couple different big findings, is that the higher the velocity, the higher the speed of impact, the more brain strain, neck strain, angular velocity, the more impact is going to be happening on the head and neck. Now, obviously, we didn't need to spend thousands of dollars on research to know that the higher speed impact, the more it was going to affect the head and neck. But the really interesting thing here is that they were only looking at accidents from about 5 to 10 miles per hour, about 9 to 17 kilometers an hour. What they found was that these football injuries, right? These football injuries that they were modeling and looking at were essentially NFL speed injuries. Majority of these injuries were greater than, or had greater impact on the head and neck than had greater impact on the head and neck than the rear end motor vehicle crashes, about 10 miles an hour. However, at that 10 mile per hour range, if the headrest was down, it's extremely similar. And if there was any head rotation during impact, the amount of stress and strain on the head and neck is the exact same as a NFL concussion at 10 miles an hour. So the headrest is down or the head is rotated. It's basically the same as getting hit by an NFL linebacker in the back of the head. That's crazy. All right? I mean, that is just absolutely absurd. So what they specifically said was that these findings suggest that the occupant whose head wraps around onto the top of a full-down head restraint during a speed change could experience brain strains that are similar or perhaps larger than those associated with concussions in 2 professional football players. If the head was rotated, if the rotated head posture the head was rotated during the head restraint impact, the brain strain compared to the neutral posture, an observation that parallels the increased whiplash injury with head rotated postures. So this is at 10 miles an hour. What they found was that with the head rest down or head rotated, they had an increase of about 1.5 times the amount of stress and strain on the head and neck. So the key points here to take away is that this is just something that is indicating that, yes, in accidents as little as 10 miles an hour, we're seeing significant head and neck injuries that are equivalent to what we would see during NFL level hits and concussions. 10 miles an hour. So when you have somebody, especially who's female, especially who's older, especially who had some head or neck pain or acute injuries afterwards, who's coming in and saying, "Hey doc, I was in an accident the other day, but it was just at 10 miles an hour, it was just at 20 miles an hour, it was just at 25 miles an hour. I really don't think that there's going to be a problem." You need to say, "Shut up, we're doing an evaluation." Right? Shut up, we need to get checked. "Oh, my little 17-year-old was in a little fender bender the other day, it's not a problem." No. We absolutely 100% need to get them checked because we're showing, right, that basically they're getting hit by an NFL linebacker in the back of the head. And that's what can be happening, especially if the headrest isn't in the proper position and it's down, because you think about how much more head and neck extension happens, especially if their head was rotated, which, let's be real, if they're getting hit at an angle or if there's somebody else in the car, me as a husband, not as a father yet, if I were to brace for impact, I know immediately I'm going to throw out my right arm to try to hold my wife back, right? And I'm going to look over to make sure she's okay because that's the most important thing. And if you have somebody who rotates that head at all during that collision, or if they see somebody coming, right, from the side, so they're looking over at that side view mirror on either side, or if they're even turning just to look up at the rear view mirror to see who's about to hit them in the back, any of that rotated head posture is going to go ahead and relate to these increase in injuries. So I want you to take that certainty with you today. When you go, you have that somebody who comes in with the little fender bender, or you know what, that parent who their child hasn't been checked yet, right? Their child hasn't been checked yet, and they're saying, well, I don't know, blah, blah, blah. They're a little uncertain. And you just have the certainty to say, hey, you know what? That little fender bender that they had, this can be a big deal. And this can end with symptoms down the line. Now, this doesn't specifically go into symptoms, but remember, a lot of what we talk about here is creating bridge in articles, right? So we know that these injuries will cause whiplash and concussion injuries, and we have several other articles that talk about those long-term effects of those very same whiplash and concussion. So we're creating a bridge here and saying, hey, this article is getting to the point of we have the whiplash, and we have articles that show the long-standing neurological deficits. We have articles that show everything from immune system dysfunction to sleep to psychosocial to post-traumatic stress, right? So what we know is to say, yes, absolutely, we need to get checked. We need to correct these subluxations of the spine happening from this whiplash injury to ensure that their body is going to heal, is going to function at 100%, because we want to allow the proper flow of fluid, the proper nervous system fluid to allow the brain to heal so we can function the way that we're designed to. All right, I'm really excited to go over this next case study with you guys. It's called Improvement in Heart Rate Variability, Dysautonomia, and Quality of Life in a Patient with Sjogren Syndrome Undergoing Chiropractic Care, a Case Report, and Selected Review of the Literature. The reason I am so excited to go over this case study with you guys, published in June in the Annals of Vertebral Subluxation Research, is because autoimmune disorders and chiropractic care absolutely fascinate me. There's just such amazing mechanisms. We're going to go into a really simple mechanism that's listed in this paper specifically. But ever since I read Dr. Demadian's research on upright MRI and multiple sclerosis, whenever I see any sort of autoimmune case, it just really, really, really gets me excited. And this is definitely no different. So for those of you guys who don't know, Sjogren syndrome is an autoimmune disease that is very pro-inflammatory, and it's characterized by dry eyes, dry mouth, overall autonomic dysfunction, and it's present in about 20% of people with rheumatoid arthritis as well. Okay, so it is a rheumatoid factor positive autoimmune disorder. So this specific case is a 48-year-old female who came into a chiropractic office because she had been experiencing pain and numbness in her left leg for about the 2 years prior. She couldn't think of any significant trauma or anything else that could be leading to this pain. All right. Upon further questioning or consultation, they found that she, 2.5 years prior, had been diagnosed with this Sjogren syndrome. So since then, she'd been gluten-free, awesome, under the care of a family MD, an orthopedist, and a physical therapist. When they did further history, she was on a ton of different medications there. It's like 7 different things because it's autoimmune. I mean, it could be Tylenol, Restasis, Flonase, Cymbalta, arthritis, ton of different stuff. She had fallen out of a tree at age 5, couldn't remember any severe consequences, but she also suffered from ear infections and allergies. The ear infection resolved, but she still was taking allergy medications and shots. She smoked 2 to 3 cigarettes a day. She would exercise about 25 to 35 minutes on a recumbent bike daily. And when she came to a chiropractic office, is basically what she had going on. So they did some x-rays. They did all 5 insight evaluations, which are algometry, surface EMG, thermal scanning, heart rate variability, found multiple levels of subluxation. They also, on radiographs, found anthrolisthesis of L5 when compared to S1, which is going to make sense with that numbness and tingling that she had been experiencing. So rather than, just simply looking at this and saying, oh, well, if you have this low back pain and I see this anthrolisthesis, let's go just adjust the low back. What they actually did was, did a thorough chiropractic evaluation. They use activator protocol to adjust levels of subluxation that aren't necessarily dependent on the pain, but rather are dependent on objective findings of areas of nerve interference. Who would have thought? With the last couple episodes of us getting in with this PTization of the chiropractic profession, that makes me really excited to see people actually analyze for and adjust subluxation. Now, what were the results? Well, she was seen 3 times a week for 6 weeks, 2 times a week for 8, once a week for 10. Given the anterolisthesis, given the arthritis, given the autoimmune concerns, I mean, that's pretty, I would say, pretty typical frequency of care, nothing too crazy. At the end, she continued wellness from there, but at the time of her evaluation at the end of those weeks, her inflammation levels had decreased on her blood work. She was taking less medication, which is awesome, and she found an overall increase in energy. Now, we don't need to have like these crazy emotional descriptions in a case study of how this changed her life, but this is a 48-year-old woman. If you think about all the different medications that she was on, if you think of how every moment of her life had been influenced by this autoimmune concern for the last 2.5 years, if you think about the energy levels, which is huge for people with autoimmune concerns, I mean, this is completely a life changed. When we talk about and educate on energy levels, if you guys deal with or take care for a lot of people who have autoimmune concerns, chronic pain, etc., what I want you to do is take the time to Google something called spoon theory. All right, this is a little side note here, but I want you to Google this thing called spoon theory. Now, if you go look through a lot of chronic pain, chronic fatigue type blogs, you're going to see spoon theory mentioned. Basically what it is what people with autoimmune concerns consider to be the easiest way to describe what it's like to have chronic pain, chronic fatigue. Now, I don't have autoimmune disease, but after caring for tons of practice members who do, talking to them about this, it just kind of makes those light bulbs click. So if you can communicate in this way with them, it'll probably just help you relate to them, help you talk about care, and probably have higher retention with them as well. So the story goes is that this chronic pain blogger one time was sitting in a diner having lunch with a friend of hers, and this person just kind of was like, you don't look sick. That's why the reason we call it the invisible illness. Like, you don't look sick, but sometimes you just fall off the face of the earth. You don't get out of bed. And like, what's the deal? How would you describe this? So they're sitting in a diner, and this blogger who's there looks, and she grabs the spoons off the table. She puts them all together. She's like, I have 9 spoons here. Okay, let's think about spoons as energy. Okay, let's say it takes 9 spoons of energy to go throughout the day, right? Maybe taking a shower is 2, maybe going for a walk is 3 spoons. And if you look at it, at the end of the day, the average person has 9 spoons of energy, and they use maybe 7. So at the end of the day, they have 2 in the reserve tank every day. On a day when they're really, 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 really busy and they're exhausted at the end of the day, maybe that's a day that they had to use all of their spoons. They had nothing left in the reserve. Now imagine if a typical day took, 7 spoons worth of energy, right? Just not even doing anything extra, just getting up, showering, going to work, coming home, and going to bed. But you with autoimmune disease, because of the process that your body goes through, you start the day at a deficit. You start the day at a 5. Now imagine if you had to wake up in the morning and say to yourself, you know what? I'm going to take a shower this morning, so that means that I'm not going to be able to walk my dog later today. And that's just how you had to think about everything. It's not anything crazy. It's not like, I'm going to go for a 5-mile run. Hey, you know what? I'm going to make breakfast for my kids today, so that means that I'm not going to be able to make dinner because I'm not going to be able to have enough energy to make dinner later in the day. And imagine if that's the decisions that you had to wake up and do every single day. So when we see a case study of increased energy levels for somebody with autoimmune disease, and we know that that's how they've been living their life every single day, oh my goodness, just being able to relate to that, just saying, hey, if you could wake up with 10, 15, 20% more energy, how would your life change? And for the average person, for you or for me, 15, 20% more energy, it's like, okay, cool. Like, what would I be able to do? I'd be able to adjust a couple more practice members. I'd stay up. I would do another research breakdown podcast. Awesome. It's all extra stuff. But for them, that extra 15 to 20% is going to be able to make them be more present at home, be able to just get through their daily things. Maybe they can just do a load of laundry. And that's completely a life changed. Now, the mechanism that they go in here is all about vagal tone. Basically, they mention that a decrease in vagal tone coming from subluxation, because we know the proximity between the vagus nerve and the occipital atlantoaxial junction. This decrease in vagal tone leads to a decrease in cholinergic anti-inflammatory pathway, which then leads to an increase in cytokines, which leads to an increase in inflammation. This inflammation is present in autoimmune disease such as Sjogren syndrome and rheumatoid arthritis. So the reason I bring this up and mention this and kind of went through all that stuff with spoon theory is, this is just a really simple case study. You read it. I like it because there's not as much about Sjogren syndrome specifically out there, yet we do see a good amount of it in practice. But this is just as simple. They did the gluten-free diet, right? Stuff people ask you about. They did this, they did that. She exercised, and this was just a missing piece of the puzzle. The fact is that her diet, her exercise, everything like that, when her body's functioning 100%, when her vagal tone is the way it should, when her brain and body are communicating at 100% of her potential. Okay, it's not just saying that everything is, diagnoses are going to be removed and everything's just going to be perfect and everything's just going to be cured. But the fact is that with that 15, 20, 30, 40% of improvement, that is a life changed. And that's what chiropractic care is about. It's not about being a miracle cure or a miracle adjustment. There's no such thing as the adjustment for Sjogren syndrome. But when we remove interference from the nervous system, allowing the body to heal and function better, we know that it's going to do just that. It's going to heal and it's going to function better. And for those who are at a neurological and immune deficit, like this woman who wasn't functioning 100% of her best, those small little changes are going to lead to huge lifestyle quality of life improvements. And that's the reason we're in the business. All right, this last article that I want to go over with you guys is a perspective. It's a review on the global burden of musculoskeletal conditions. Now, you guys may know that I don't really like to focus on pain, just aches and pains specifically, but this is looking at just overall the musculoskeletal system as a whole and how it affects global health. All right. It basically goes into the fact that there's 150 diagnoses that affect the locomotor system, our body's ability to move. 1 in 2 adults, so 50% of Americans, are living with pain from a musculoskeletal condition. 50%. So if we look at just globally, that disability adjusted life years, so basically the years, if you take all the years that people are alive, that they're living with disability, right? So let's say that in my life, I live 2 years with disability. In your life, you live 4 years of disability. If you add up all of those years in the world lived with disability, right? 61% are from non-communicable diseases. 61%, which is up from 43% 25 years ago. That's absurd. So we've done so much work in looking at malaria, communicable diseases, spreadable disease, but we're really doing a bad job when it comes to things that do not spread. They call for a need for integrated care because with musculoskeletal conditions, there are so many comorbidities, right? Obesity, cardiovascular disease. These people are more likely to have musculoskeletal conditions. So they bring out 3 opportunities for action, okay, or 3 priorities. The first is including musculoskeletal conditions in the global action plan. Now, because of these rising numbers globally, we have an action plan for global strategy for the prevention and control of non-communicable diseases, but it only focuses on cardiovascular disease, cancer, diabetes, and chronic respiratory disease. It doesn't have any strategies to actually incorporate aches, pains, musculoskeletal conditions as well. All right. Now, because of how much this is affecting our world, our globe, 61%, right? We need to expand this to include physical therapy, chiropractic, which can help with aches and pains, although it's not really what the focus of the podcast is, etc. Second, and this is what I really believe to be important, is they call for including functional ability to be an outcome measure in seeing what we can do. Functional ability. That's taking the thought off of this person scaled they were an 8 out of 10 pain scale, to saying they had a 60% reduction in their ability to walk. They could only climb 10 stairs, and this is the improvement that we saw. Now we can climb 10 stairs. Now we can walk a mile. Now we can walk 10 steps. Now we can do all these different things. So changing the viewpoint to functional ability. They ask for national policy reform, right, to spread, once again, from cancer, diabetes, chronic health, respiratory disease, cardiovascular disease, and most recently mental health, to musculoskeletal conditions. Now, this is called reducing the global burden of musculoskeletal conditions. The key takeaways here is that, even if you're a chiropractor who focuses mostly on pain, even if you're somebody who isn't, the fact is that 1 in 2 people who we meet have pain from a condition of their musculoskeletal system. Now, because we know that the nervous system controls and coordinates every function in the entire body, if we do have a symptom somewhere, just simply by tracking the way the nervous system functions, chances are we're going to have other comorbidities there. So yes, oftentimes it's very easy to meet somebody on that level of, hey, you experience this pain. Let's work with you. Let's get you here. Let's look at these functional changes. It's not about the fact that you have a 6 out of 10 pain. It's about the fact that I want you to be able to dance at your grandson's wedding, right? But go ahead and expand that as well to these other things as well, these other comorbidities. Look at this and say, you know what, it's not just about us, but literally what we're doing, what's being called for, what we need is integrated care, is something other than opioids, is something different than drugs, to be able to come in and allow our community, our globe, our world to live better lives. Because yes, we're living longer, life expectancy is greater than ever before, but those years that we're adding, if they're sick, they don't mean anything. So I hope this inspired you guys a little bit today. I hope you guys enjoyed today's podcast. If you have anything that you want us to chat about in the future, please email that over to us at team@chiroedgemedia.com. If you found some value from today's podcast, please jump on iTunes or your podcast of choice, subscribe, rate, review, and most importantly, if you know any chiropractors who can really benefit from having some certainty, some clarity, some research in their lives and their practice, please share this with them. The reason we have this isn't to make a dollar, but it's just simply to share the information that's out there and bring value to communities. All right. Once again, I'm Dr. Anthony Pellegrino. This was your week's Chiropractic Research Breakdown. I look forward to seeing you guys next week.